सोच में सकारात्मकता लाएं, जीवन को बेहतर बनाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। मनोदर्पण पर कॉल लगाएं, मनोबल अपना और बढ़ाएं। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। चलो आज ही प्रण ले हम, मानसिक स्वास्थ्य सुधारे हम। मनोदर्पण के काउंसलर से परामर्श पाने के लिए डायल करें टोल फ्री नंबर 844-844-0632। नंबर एक बार फिर सुने 844-844-0632।
Namaskar. Very warm welcome to all the viewers out there. You are watching us live on eVidya channel from channel number 6 to 12. And apart from all those channels, you are with us on our YouTube channel as well, that is NCERT. And I am Renu Bhatt with you all, and this is our very special session, Sahyog. And let me tell you some brief about Sahyog sessions. Sahyog and Parichorcha sessions are held under MANODARPAN initiative. It's a brilliant initiative by Ministry of Education under Atmanirbhar Bharat Abhiyan, so that we can provide psychosocial support to all the students, parents, teachers across the country, and we talk about their mental well-being as well. In this specific session, we are going to know more about separation anxiety among students, causes and remedies. This is the title that we are going to discuss today in this specific session. We have joined by our experts as well. Without any further delay, let's quickly meet them. You are Dr. Uday Vai. You are from Regional Institute of Education, NCERT, Mysuru. Very warm welcome, sir.
Namaste, madam.
Namaste, sir. And we have joined by our practicing counselor as well. Let's meet him. You are Mr. Tongle Govind. Very warm welcome, sir. Namaskar.
Namaste, ma'am.
And before we start this session, let me share some certain information to all the students, teacher educators out there. In case they have any query related to this particular topic, you can reach out to us through our various mediums. You can call us on our telephone number, that is 8800440559. Either you can drop an email as well on our email address, that is sahyog.ncert@ciet.nic.in. And apart from these mediums, you can drop your comment on our YouTube channel as well, that is NCERT official. And dear learners and viewers, we have our MANODARPAN National Tele Helpline number as well, that is 844-844-0632. And without any further delay, let's quickly get back to the session in which we are going to discuss today is separation anxiety among students, causes and remedies. So Govind sir, my first question to you would be is, what exactly is separation anxiety and what are the alarming signals and what are the symptoms, sir? Please explain to us, sir.
Yes, ma'am. Happy evening to all the viewers. Today we are going to discuss about the separation anxiety and its causes and remedies. Before going to its causes and remedies, first we will see what is the definition of separation anxiety. It is a feeling of negative emotions such as loss, loneliness and sadness that are experienced by individuals when they are separated from an important person or beloved person in their life. So it may be their parents, it may be mother or father or any other relatives. So most children usually display separation anxiety till the age of 3, which is considered as a part of healthy development. When it comes to however, if seen beyond the age of 3 or 4, it may affect a child's daily activity and tasks like going to school, peer interaction. When this fear affects a child over a age of 6 years, is heavy or lasts longer than 4 weeks at stretch of age. So the child may have it severely called as separation anxiety disorder. It's a kind of disorder. It is characterized by experiencing extreme anxiety or even having panic attacks and completely hamper the functionality of a child. So there are some symptoms and alarming signals regarding this separation anxiety. We can see here children may feel when their beloved leave them, they will feel that they are going to have any trouble. And it may happen vice versa, like sometimes children will feel that we are going to have some problem. So, and they will refusal to go to school in order to stay with their caregivers and refusal to go to sleep without the caregiver being nearby. So they will feel upset, and they have this fear of alone, bedwetting, nightmares about being separated, complaints of physical symptoms such as like headaches, stomach aches, repeated temper tantrums, or pleading, intense fear or guilt, social withdrawal, difficulty contracting to stomach aches, headache, dizziness, nausea, and vomiting, diarrhea, chest pain, trouble in breathing. So these are the some symptoms and alarming points.
Okay,
Yes, ma'am.
so this is what separation anxiety is, and this is the signals and the symptoms. And here let's move towards our next speaker, Uday sir. Here we would like to know more about the causes, sir.
Yes, ma'am. Before we go for causes, there are certain major types of anxiety disorder or separation anxiety. Separation anxiety is one among the different types of disorders. There are few types of disorders, for example, generalized anxiety disorder, panic disorder, social anxiety disorder, health anxiety disorder, separation anxiety disorder, phobias, agoraphobia, obsessive compulsive disorder, body dysmorphic disorder, and perinatal anxiety. So there are few types like this, and now let us go for the causes of separation anxiety. Most of the times it is found that there are two basic reasons. One is genetical and the other one is environmental. When it comes for genetic, it is caused by both biological and environmental factors. As a child may inherit a tendency to be anxious from parents, and it happens sometimes from parents, sometimes from environment, surroundings, so, or due to certain occurrence of any circumstance, incidents, and it happens mostly because of an imbalance of two chemicals in the brain. They are called as norepinephrine and serotonin, and these two mostly like plays a important role in the development of separation anxiety among the children. And in this, one maybe because of the loved ones, they get separated, they get detached from the children, and the other one among the loved one, that could be a human being from the parents, siblings, relatives, friends, neighbors, anybody else. And sometimes that may also relate to anything in the environment surroundings like pet animals, pet birds, or any of the closest things. Sometimes the dislocation of their place, relocating from one school to other school, one place to other place, one city to other city, town to town, village to village, may also cause. And besides that, children whose parents are overprotective will also be generally termed as the more prone children to have the separation anxiety. In fact, it may not, that cannot be a disease, but again, if the child and the parents, if they are unable to identify it at the earlier stage, then that develops into a kind of very big disorder. So that a sign of parental separation anxiety, well, so that can be the major cause. Parent and child can feed each other. Sometimes due to parents and their anxiety, children will also get the same qualities, and sometimes by seeing the children, parents may also develop the separation anxiety. And here, children with separation anxiety often have family members with anxiety or other mental disorders also. So generally, which suggests that a risk of getting the disorder may be inherited also. So insecure attachment to parents or caregivers, or the overdevelopment of stress, other anxiety disorders like panic attacks, social anxiety disorder, phobias, agoraphobia, or sometimes obsessive compulsive disorder or depression can also be one of the reasons. And all these put together, we can say that different factors can also include and they can be told as life stresses or loss that result in separation, certain temperaments which are more prone to anxiety disorders, and over emotions that could be pathetic, that could be over joyful, and many of the things that may also develop certain such kind of temperaments also develop separation anxiety. And family history, if there are any people who have got certain health ailments, they may also have an environmental issues also. So the children generally who have this kind of separation anxiety will always cling to the parents. They refuse to do the things that require separation, and then extreme crying may also be there. Developing temporary physical illness may also happen every time. They also have most of the times violent tantrums, that they become so violent sometimes poor academic performance, and sometimes inability to interact with others, mingle with others, joyfully engage with them, and sometimes refuse to sleep alone, sometimes nightmare, fear of loneliness, bedwetting, intense guilt factors may also take place, madam.
Okay, fine.
So
So,
those are all the causes.
those are the possible causes that can create student separation anxiety in a student. Sir Govind sir, here we would like to know what role does separation anxiety play during different stages of student academic life?
Yes, ma'am. It plays a prominent role in the stages of life of students. When it comes to the early childhood, this anxiety can make it difficult for the children to attend school, participate in class, or make friends. And this can lead to the academic problems such as missed school days, poor grades, and difficulty in concentrating. So when it comes to the middle school and high school, the separation anxiety can manifest as social anxiety, and this can lead to academic problems such as lower grades and difficulty in completing assignments. When it comes to the college level, separation anxiety can make it difficult for students to adjust living away from home and being on their own. So they may worry about their safety, their ability to manage their time, or their ability to succeed academically. So this can lead to the academic problems such as procrastination, missed classes, and poor grades. So in all stages of academic life, this separation anxiety can also contribute to other mental health problems such as depression, low self-esteem, and substance abuse. Yes, ma'am, this is about.
Okay. So, Uday sir, are there any possible remedies to make student overcome this situation? There
Yes,
must be
yes,
some,
yes,
sir.
madam. Yes, madam. Definitely, there are few preventions, preventive measures, and there are certain treatments available for the children to make them overcome the separation anxiety. So, in an other way to say that there is no sure way to prevent this anxiety disorder in the children, but there are few recommendations that can definitely help the children and their parents for their well-being of the whole family. So here, seeking professional advice as soon as possible when the parents observe that the children are having these kind of separation anxiety symptoms continuously for over 4 weeks, for a month, and then from the years 3 to 4 and 6, even after crossing that, if the children are having this kind of continuous for 1 month or over 4 weeks of time, these kind of separation anxiety symptoms, then they should definitely approach the professional help. And if they are concerned that their children anxiety is much worse than normal development stage, and the early diagnosis can help reduce symptoms and prevent the disorder from getting worse. The other thing is that they have to stick on with the treatment plan to prevent relapses or worsening symptoms. That might also trigger, that might also become double if they do not follow the measures or the medical or the professional advice properly. Sometimes seeking professional treatment if they have anxiety, depression, or any other mental health concerns. As the parents, even if they are found that they have any such kind of issues pertaining to them, they should also take help of the medical advice and the treatment, and so that they cannot make it pass on to their children or the next generation. In another way, madam, we can have it in a separation understanding that children can also have this kind of remedies to overcome. The parents can take certain measures to make their children overcome that. Parents can help babies and toddlers deal with typical separation anxiety in the following ways. Keep transitions short and sweet. Any kind of transition change, do not take them from village to a metropolitan city that the children will not be able to balance or adjust with the surroundings. From a minimum average school to a very different school where they cannot cope up. That should not happen, and they can have a goodbye routine in the consistency. Morning, evening, they can have that kind of relationship with children. They can build trust returning when they say you will be okay, all right, and then practice being apart by letting trusted caregiver babysit. They have to give confidence to the children that we are there to take care of you. Anything happens, we are always there with you. Though you are going to school and coming, we are always there. Even in the school, if something happens, we will be definitely available to reach you. So that kind of confidence must be developed. And how this can help the children develop medically, it is said that separation anxiety disorder in children can be treated with cognitive behavioral therapy. It is how it helps us to understand and manage their fears, and it is used during separations to help children learning cope up skills. These skills can be used when a child is feeling anxious. And in separation anxiety disorder, their child is, if found that severe, medication may be also prescribed. Antidepressants called as selective serotonin reuptake inhibitors or SSRIs can also help the children. This is completely the theoretical and the kind of psychological and medical help. And for adults also, that is for the children who are at the high school or the higher secondary or the college level, for them also the cognitive behavioral therapy will definitely be useful. There are few more things like diabetical behavioral therapy, a type of therapy that helps to deal with the difficult emotions, family therapy, grouping therapy, and medications also available that can also be prescribed as the antidepressants, and a few more things like benzodiazepines. That such kind of medication can also help to manage the symptoms. On another way, we can say that for people with this separation anxiety or mild separation anxiety disorder, education and coping techniques may be enough to help them manage their symptoms. Some things they can do help manage their separation anxiety include, they are learn about separation anxiety disorder. We should know that what is this, what will be the symptoms, what are the causes, why does these sudden behavioral changes happen, how long it has been that the child is exhibiting these kind of things, how long have I been also projecting these kind of things. They should first learn, they should have the awareness of this. Then they should determine the triggers with their separation anxiety. What is the reason, what is the cause, due to what things that these things are more recurrently happening or triggering. Then they should also practice self-care. Then they have to also manage with their stress. In another way, these are the common things that the casual remedies without going for the professional or the medical help, these are so commonly can be done at home and with most of the people without any knowledge of this separation anxiety much in depth also. In the morning, the child may be received by a teacher or a buddy at the school. Somebody should be there to welcome them. They can also introduce fun ritual when the child comes to school, like watering a plant, spending 5 minutes in the play area, or anything the child want to aligning with his or her interest. Then identifying a non-threatening place where the child feels comfortable in the school. It could be meeting the teacher, counselor with whom the child is comfortable, or giving access to a soft toy pillow which facilitates contact or comfort. These things can also be provided, and seen that these separation anxiety symptoms or such kind of illness can be completely eliminated. Then the child may be allowed a phone call at home if there is extreme anxiety. Facilitate sometimes the conversation with the peers, with the friends at home, outside, at the playing group, or in the school somewhere. Then help from the teacher or counselor may be beneficial for the child and the other children they are interacting with. And the child may be allowed to come late sometimes when these kind of children are found, that when we find some children having this separation anxiety, let them come a bit late for some gradual kind of amount of time. For example, like 1 week, 2 weeks, 3 weeks, 4 weeks, hardly 1-2 months. Let us see that the child behavior might change. They might overcome from the separation anxiety. Then the child may be allowed to come late, but gradually trained to be punctual. Slowly we can mold up them to stand on, stick on with the general rules, regulations, norms. And then be generous with praises. They should appreciate, we should reinforce them, we should develop a positive attitude in them. We have to inculcate the confidence related aspects in them. And the child should be trained to practice deep breathing exercises, relaxation techniques like yoga, meditation, sports, cultural activities, curricular, co-curricular. The more that we involve the children in these kind of activities, the more it is found that the children will completely withdraw from this the loop of separation anxiety. So that's all, madam. Definitely there are possible ways of making children overcome the separation anxiety disorder.
Thank you so very much, sir, for sharing all your information with us. Definitely there is a problem, but there are few solutions as well, and we as a guardian need to focus on what exactly we should follow. And here, as we are running very short of time, we have to wrap up this session here only. But before that, thank you so very much, Uday sir and Govind sir, for being with us. Thank you, sir.
Thank you.
So let me wrap up this session, but before that let me share very important information with you all regarding NCERT textbooks. NCERT textbooks for the year 2023-24 are available throughout the country, and these textbooks may be purchased directly from NCERT sales counters located at New Delhi, Ahmedabad, Bengaluru, Kolkata and Guwahati. These sales counters will be functional on all the weekdays, including all the gazetted holidays, Saturdays and Sundays, as well from 9:30 AM to 6 PM. You may also place order online from our our website, that is ncertbooks.ncert.gov.in, and these books will be delivered at your doorsteps with no delivery fees. And if you want a soft copy of all those books in PDF version, it can also be downloaded online from NCERT, Diksha, ePathshala website and from our mobile app as well. We would request you to visit our website, that is ncert.nic.in, to know more about the authorized vendors. With that note, me, Renu Bhatt, along with my whole team is taking your leave. Stay healthy and be with us on eVidya channels and NCERT YouTube channel. Namaskar.